Hey guys, it is anatomy time. Here we have the diaphragm moving behind the rib cage with breathing. You can kind of see the heart behind the rib cage there, but that is mainly the diaphragm. And here we have the lungs as they expand and contract, expanding with air, filling with air. They are moving the diaphragm down, and then the diaphragm goes back up as you exhale. And there is the viscera and how it reacts to the movement of the diaphragm when you are inhaling and then exhaling.
I hope you don't get queasy. I'm going to show you live video of a singer's vocal cords as she sings. You may want to sit down. I'm Chuck Gilmore with Power to Sing. Many students feel singing is a great mystery. They don't understand how their voice works, why it works the way it does, and what's involved with singing. It all begins with the vocal cords. Specialists look at your vocal cords with a flexible or a rigid scope. The flexible scope is a small cord with a camera at the end of it. It's inserted through the nose and extended down the throat to see the vocal cords. The rigid scope is like a large pen with a camera at the end. It's used looking into the mouth and throat. Both images look like this. This can be confusing because the vocal cords are horizontal in the throat, like this. They are not vertical, like this. When the scope sees the cords and projects it on a monitor, they look like they're vertical or up and down. Vocal cords, sometimes called vocal folds, are located in the mid portion of your neck, about halfway down, between the top and the bottom of your neck. There are two vocal cords, and they're connected in the front of your neck and open and close in the back, or towards the back of your neck. They're located inside the voice box, or larynx. The cords sit at the top of your windpipe, or trachea. Men can feel the top of their voice box, often called the Adam's apple. Women have the same thing, but it's smaller and harder to feel with your finger. Your vocal cords are just behind the Adam's apple.
Pause. I think we need a little bit more explanation here. So, this is your larynx. You've got the epiglottis at the top. That's the piece of cartilage that comes down and covers your windpipe when you swallow so that you don't have to cough or choke. The hyoid bone is also at the top there. You've got the thyroid cartilage, which is the Adam's apple. And then you can see the trachea, also known as the windpipe. This is where your air is supposed to go, not your food and drink, hence the epiglottis. Here's another angle. So you see the epiglottis, the hyoid bone at the top there. Those triangular shaped things there are called the arytenoids, and they're attached to the vocal cords or the vocal folds. Again, you see the thyroid cartilage, which is the shield that protects your vocal cords, and then it sits on top of a ring-shaped cartilage called the cricoid. It pivots on top of it. You can also see another image of the trachea there. Whenever you take a good deep breath, you're looking between your vocal folds or through the glottis. You can see the rings of the trachea. Here's another image. This is from the back side. You see the hyoid bone at the top, the epiglottis, the arytenoids, the edge of the thyroid shield, the cricoid cartilage, and again the trachea. You can't really see the vocal cords from here because they are attached to the arytenoids, so they'd be kind of hiding behind the arytenoids right now. But when the arytenoids pivot back and forth, that's how the vocal folds open and close. And then one more image, you've got, you're looking at it from above. You see the arytenoids and you see the cricoid, and what you don't see is that the inside center tips of those arytenoid triangles, that's where the vocal cords are attached, and then they attach to the other end of the cricoid cartilage through muscles and ligaments and things like that.
I can feel a small V right in the center of the top of my Adam's apple. That's the cartilage. Now at birth, our vocal cords are about the same length, approximately 2 millimeters. By age 20, women's cords are about 10 millimeters and men's 16 millimeters in length. The change for men is much greater, and this causes a deepening of the voice and can make singing during the vocal change much harder. Vocal cords are tissue. There are different layers of tissue. Vocal cords have 3 primary layers: muscle, ligament, and mucosa. It's the slick outer layer vocal cord. The vocal cords open when we breathe and come together when we make noise with our voices, and are covered up when we swallow. A type of lid called the epiglottis closes over the vocal cords when we swallow. Sometimes fluid gets through and we cough to clear.
I'm inspired now! Yes, science!
When air passes through our vocal cords as we speak or sing, they create a series of sound waves, which we can hear. This series of sound waves we call vibration. The vocal cords create the initial vibrations, which is the initial tones we hear that begin the sound we make when speaking and singing. Now watch and listen as these vocal cords create the vibrations that become our voices.
I find as a choral conductor, sometimes I and my colleagues are not all that sure about what the actual vocal instrument looks like. We may have models and we have books to look at, but not very often do we get to actually see the vocal folds themselves. So I decided it would be fun if we all took a trip to Baylor All Saints Medical Center in Fort Worth to the vocalogist. And her name is Amy Hamilton. Hi, Amy.
Hello.
And what is a vocalogist?
I am a speech-language pathologist specialized in assessing and treating voice disorders.
She's not saying I have a voice disorder. Well, we're about to find out. But nonetheless, we're going to see my vocal folds. And how will that happen?
We're going to do a video stroboscopy exam to take a closer look at your vocal folds. It has a strobe light, not unlike the strobe light used in the disco era, to give us the appearance of the vocal folds vibrating. If we look at your vocal folds vibrating through the naked eye, it looks like they're staying still because they're vibrating so quickly.
Great. Let's go.
Okay. There's a flat electrode microphone to communicate with the stroboscopy light how many times per second your vocal folds are vibrating. I'm just going to have you lean forward. Stick your tongue out at me. Okay. And let me get in. Okay, go ahead and say E. Good. Try it again. And again. Good. Go to a speaking pitch. Good. I want you to really smile and bite down on the scope and think E. Good. Good. And again, hold out a long time. Good. I want you to come on out.
Well, now that Amy has her endoscope out of my mouth, she's going to explain to us what we were seeing and what the parts are.
Okay, this is the view as if we're walking to the back of your tongue and peering down your throat. These are your vocal folds. They're two white bands of tissue that sit like a V on top of your trachea, which goes down to your lungs. So when your vocal folds are wide open, the air just goes in and out as you breathe. And when they come together, they vibrate and that produces your voice. These are your arytenoids. They open and close your vocal folds. This is the epiglottis. It covers the larynx as you eat and drink so that you don't cough or choke. The vocal folds should be a pearly white color, and we want to see nice smooth edges so that when they come together to vibrate, we create a complete closure.
Great. And can you fast forward that a little bit so we can show that closure?
This is the complete glottic closure at 190 hertz, which is a higher pitch for you, and that's why you have a tiny posterior gap.
Wow, but pretty good closure.
Yes.
And they are pearly white.
Yes, they are. They look very good. Okay, here we go. Stick your tongue out at me. Good. Okay, go ahead and say E. There we go. E.
Eh.
There we go. Okay, try glottal fry. Do a hard glottal attack. E. Good. Do that again. Good. An easy onset. Try that again. Good. Do that again. Good. Do a high pitch. Good. Try it again. Good. Do a low pitch. Think E. There you go. Good. Do a slide from low to high. Let's do an octave. Good. Do it again. Good. Go he. Good. Clear your throat. Good job. Do another conversational pitch. Do straight tone. Do a higher pitch with vibrato. And then straight tone. Good. Do that again. Good job.
Awesome.
Did I get everything?
Inspiring. I knew I was going to have a trip to the vocalogist, so I was drinking a lot of water to make sure that I got that pearly white vocal fold that you saw a little earlier. But I wanted to ask Amy if she would give us, as choir directors, some tips that we can help our singers with vocal health.
Yeah, we'll start with hydration. It's a common misperception of singers that when you drink water, it goes directly over the vocal folds to wash them off. If that were to happen, it would go towards your lungs and cause you to cough and choke. Instead, what happens, once you drink water, it takes several hours for it to be dispersed throughout your body at the cellular level and come back to the vocal folds at that cellular level.
So I can't hydrate 10 minutes before choir
Absolutely
rehearsal?
Not. You need to be hydrated all the time. When your vocal folds come together to vibrate, they do so very quickly, and that causes a lot of heat, friction, and resistance between the vocal folds. And if the tissues aren't properly hydrated, then that can cause some damage to the tissues. The basic rule of thumb for how much water one should get is to take your body weight, divide it by 2, and that's how many ounces of water you should get a day.
Okay.
Basically, singers pee pale. The saying comes from you want your urinary output to be pale to clear. Things that count for water besides water: Crystal Light, herbal decaffeinated tea, flavored waters, Powerade, and Gatorade. Juice doesn't count as water because it takes the amount of water in the juice to metabolize the sugar. For every caffeinated or alcoholic beverage you drink, you should add an extra glass of water because caffeine and alcohol are dehydrating.
Right. And there is that little thing about flying on an airplane plus alcohol and caffeine?
Right. One alcoholic beverage in the air counts as 2 on the ground, so it has more of a dehydrating effect. And for every hour in the air, you should drink 6 ounces of water.
Wow. It's
keep your
really
vocal-
dry in those airplanes.
They have no or very little humidification in the circulating air.
So when we drink water, it doesn't affect the vocal folds because it doesn't pass over them.
Right.
But what about a gargle?
The gargle recipe we give to our patients is Dr. Gould's gargle recipe, who's a prominent ENT for singers who's passed away. And it includes, you need to inhale steam for 2 to 3 minutes before you do the gargle. And the gargle includes ½ teaspoon of salt, which exfoliates and cleans the tissues, ½ teaspoon baking soda, which is an antimicrobial, antifungal, so it kills germs, ½ teaspoon clear Karo syrup, and 6 ounces of warm water. You mix it together, gargle, spit it out, and don't eat for 20 to 30 minutes after so that it will stick to the tissues.
Wow. So you keep this on hand Dr. Gould's gargle pretty much all the time.
Yeah, we suggest that you use it 2 to 3 times per day for 7 days.
And can you give us a little quick rundown of medications that might be good or bad for us?
Sure. A lot of medications, the over-the-counter sinus medications, can be drying, so we suggest you drink an extra glass of water to your minimal water intake. Aspirin is a blood thinner, so it can increase the risk of hemorrhaging the vocal fold.
Antihistamines, decongestants.
Antihistamines are drying, so you add an extra glass of water. Guaifenesin is suggested.
Mucinex
Yes. You got
is
it.
our friend.
Yes, that's right.
Mucinex is our friend.
That's right.
And anything else you could think of that would tell us as choral singers that we can help our choir directors?
Well, as far as throat clearing goes, when you clear a throat, you slam your vocal folds together and rub them real hard, and that can be really damaging to the vocal folds. No one has ever died from not throat clearing, so we suggest that when you feel like you're about to clear your throat, whether it's a scratchy or rawness sensation, that you try to do a hard swallow instead of clearing your throat, which is just pumping the back of your tongue real hard against the roof of your mouth as you swallow. And if you need water or liquid, you can use that as well.
And I have a choir singer that comes to me and says, I'm hoarse. How do I know when to send them to a vocalogist or an ENT or a laryngologist?
You need to send them to an ENT if they're hoarse for 2 weeks.
So if they come the third week and they say, I'm still hoarse, they need to go to a doctor.
Yes.
And lastly, we've talked about antihistamines and all kinds of decongestants and water, but we haven't talked about GERD.
That's right.
Tell us about it.
There are 2 kinds of acid reflux. The first is more commercialized, gastroesophageal reflux disorder.
Can you say that again?
Gastroesophageal reflux disorder.
Very good.
And that causes the heartburn and indigestion that we see on commercials. The other kind is laryngopharyngeal reflux disorder, or LPRD, and that's when a little bit of stomach acid escapes from the esophagus up into the back part of the larynx and actually causes a low-grade tissue burn to the tissues.
It can also cause hoarseness.
Cause hoarseness, chronic throat clearing, a persistent cough, difficulty swallowing, and there's many symptoms.
Great. Thank you so much. I think we're going to be better choir directors for having visited the vocalogist. Thank you.
Thank you.
Here's my buddy Bill. Bill's going to help walk us through a laryngoscopy. He's a half head. There you go. Anyways, what we're going to do with the flexible laryngoscopy is we're going to go through the anesthetized nose, and when the camera gets back to what's called the nasopharynx, the pharynx being this vertical tube here, it's going to turn 90 degrees and look downhill. We're, of course, going for the vocal cords, and they are down here, Bill's Adam's apple. They are connected just below that. So on me, just below this line here, that's where my vocal cords are.
Here we have an illustration of our friend Half-Head Bill, and we are going to zoom in, and you see there that very, very giant thing that is labeled the tongue, the strange-looking pointy white things that are your teeth. A little behind that, the hard palate, which if you put the tip of your tongue on the roof of your mouth and you feel the hardness behind your teeth that's slightly ridged, that's your hard palate. It is non-pliable. It does not move. And then if you continue to run the tip of your tongue a little farther back, you feel it begin to get softer. That is the soft palate, and it does move. It is important to note that the soft palate movement is very important to vowel sounds and tone quality. So this is the actual still shot of the soft palate. The arrows are pointing to the soft palate itself. And when he is looking at the movement of the soft palate and looking for that symmetry, it is helping him to check for healthiness. Whenever you go to the doctor and you say, ah, it raises the soft palate and lowers the tongue so that they can see the back of the throat easier. It also helps you have a better singing tone.
I go ahead and take a look in the mouth, and what I'm looking for specifically is how the palate moves, because that's run by cranial nerve 10. And I have the patient say, ah, and I watch for symmetric elevation of the palate. And because we're looking from above, the front of the voice box is at the bottom of the picture, the back is at the top, and it's inverted on the screen. The right shoulder is going to be on the left side of the picture. That makes this white line the right vocal cord and this one the left vocal cord. These are called the true vocal cords. That's where we get sound from. These are called the false vocal cords, and we can speak with them. If we squeeze everything tight, they will vibrate at a very low pitch, but we don't usually use it. There are 2 bumps here on either side. These are called the arytenoids. They are not vocal nodules, but I swear every singer asks me if they are. We zoom in on the vocal cords, and I tend to watch them for a little bit while someone breathes because there should be some movement with breathing. It should be symmetric. We can compare one side to the other. And then I will have the person make a sound. And with that sound, we'll end up watching the vocal cords come together. That process is called abduction or opening and adduction or closing. And we bring them together to cough, to speak, and when we swallow, to close off. So basically the vocal cords are a valve. We might turn on what's called a strobe light and perform a stroboscopy. The videotape is recording at 30 frames a second. And when I'm talking to you here, my vocal cords are vibrating 100 times a second. So the video can't possibly record it, and all you see is blurring. But if we take a strobe light, turn it on, match my pitch, set it off from the pitch just slightly, just like the helicopter blades we see spinning in the sky, they look like they're moving, we can see apparent motion of the vocal cords. We will look for symmetry and suppleness of the vibratory wave. We will look to see how well the person completely closes them, how much time they spend closed, and some other details of the vocal cords.
And I'm curious about this tape that you brought. Can you tell us a little bit about what's going on in this video?
Well, I particularly like this video because you can see that my vocal folds are sitting on top of my airway, and you can see my tracheal rings. And the first thing you see me doing is closing my vocal folds to make sound. And when the vocal folds close and air goes through them, you can see that they vibrate. I will run out of air, and you can see that I open them up again. And then I go to make a sound at a slightly lower pitch, and then you can see my vocal folds are slightly shorter because the pitch is lower. You can appreciate that the vocal folds have a nice floppy skin on them as they vibrate. That helps with good sound. And as I go up in pitch, you can see that my vocal folds are stretching out. One of the things that is notable about my vocal folds is that I have a little bit of acid reflux, so you can see that the space between my vocal folds in the back of the picture it's a little red and puffy, and that's an indication that I have a little bit of reflux, although it doesn't seem to affect the way I sound too much.
You would describe this as being 100% normal as far as vocal folds are considered?
They do seem to be normal. The way I use my vocal folds is a little different. I have a little gap in the back, and you can appreciate that because my voice is slightly breathy, but that's a cultural norm for American females. Other than that, they're pretty normal. They're white and pearly, and they don't have any lumps or bumps on the edges of them that would impair the skin on the vocal folds from vibrating the way they are.
Most people are aware that the bigger the instrument, the lower the pitch. If you have a tuba, it's a very low pitch. A flute, which is a much smaller instrument, plays a much higher pitch. Vocal cords are a little strange in that when they get longer, they actually perform a higher pitch, whereas when they are shorter and relaxed, then they are playing a lower pitch. This contradicts the small instrument equals high pitch theory. Unless you think of it like this. The vocal cords are a lot like a rubber band. You stretch the rubber band, it gets longer, but the edges are thinner. When the rubber band is relaxed and smaller, the edges are thicker. It's the vocal cords' edges that are opening and closing and creating the pitch. So when the vocal cords are stretched thinner, they are longer, but they are producing a higher pitch, such as shown in the photo right here. This is a higher pitch being produced by these vocal cords. And in the next photo, we have a lower pitch. It's a little bit more relaxed. It's smaller. Whenever those vocal cords open and close and hit up against each other, there's a little bit more motion visible because of the relaxed nature of the vocal cords. Now watch this next clip and you'll actually visibly see the change in size of the vocal cords.
High to low. Say hee hee hee.
So here's our narrator from before. He's got half-held bill there and his flexible endoscope. And he's going to show you how that endoscope goes into the body, into the head. So you can see it on the model, but then up in the upper right-hand corner, you can see what it actually looks like, what it's actually capturing with the film as it goes into the nasal passages, through the nasal cavity to the nasopharynx, down the pharynx, past the oral cavity, so that you can actually see down on top of the vocal cords themselves. We're looking down at the vocal cords, and since the front of the neck is at the bottom of the screen, everything else is upside down. So you have the right vocal fold on the left and the left on the right. Whenever you breathe, your vocal folds open wide to let in the air, which goes between the folds, the area called the glottis, and into the windpipe via the trachea. The arytenoids are triangle-shaped cartilages that pivot, controlling the movement of the vocal folds. The epiglottis at the bottom of the screen is a bit of cartilage above the glottis that comes down to cover your glottis, which again is the passage between the vocal folds to the windpipe. It's so you don't cough or choke when you swallow. The folds open wide for breathing, but only a little bit for speaking or singing like that.
And when we go to make a sound, if we turn on a strobe light, we can see what the vocal cords are doing in slow motion. Vocal nodules are a result of overuse, primarily in terms of quantity, but also in terms of volume and perhaps in technique as well. And when they strike each other too often and too long, the same effect happens to the vocal cords that happens on the hands. That is, a callus begins to form, and a vocal nodule is essentially a callus of the vocal cord. Because of this, it will nearly always occur right in the middle where the vocal cords strike each other almost all the time.
Hang on, we gotta talk about this. See how in each of these, the bump or callus or node or nodule thing is dividing the glottis or the space between the vocal folds in half or sometimes even 3 parts? This allows for each portion of the vocal folds to open and close at different rates of speed or frequencies. This can cause 2 or 3 pitches to be produced at the same time. It sounds like a train whistle. It's called diplophonia, and you're going to hear some really great examples of diplophonia in the following clips.
A nodule is fairly easy to detect by listening to a soft, high sound. At low pitches, which is where we speak most of the time, the vocal cords are short and lax, so they vibrate easily, even with a bump or a stiff area on them. We stretch the vocal cords as we go up in pitch, and this will make the bump stand out.
Ew, look at how stiff and jagged those folds are.
And because we are tightening the cords, a callus will stiffen the vocal cords further to the point where they do not vibrate. A person with vocal nodules usually automatically compensates in 2 ways. They phonate louder to jump-start the stiff cords, and they hold the vocal cords further apart to keep the bumps from touching and stopping the vibrations. Let's watch in slow motion the onset of phonation, and we can see the person pull the cords apart until they are allowed to vibrate. When nodules touch, they can cause interesting sound effects like a jump in pitch.
This one is a really good visual for different frequencies in the folds.
As suddenly only half the vocal cord is vibrating.
Okay, seriously, I know you're laughing, but you need to hear this next part. Are you listening? Hey!
One can hear diplophonia, that is 2 pitches, as the nodules touch.
It's a good one! Check it out! Listen!
Because the front and the back sections may vibrate at different pitches.
One more time.
Touch. Because the front and the back sections may vibrate at different pitches.
Bam, 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 bam.
Nodules are a thickening of the skin, and they can be very flat, or they can be very thick. They can be tiny and single, and only impair a single pitch. Let's look at an interesting case. Here we listen to a singer ascend in pitch. There's mucus accumulating in the middle of the vocal cords, so we cannot see if there are nodules, though she is a vocal overdoer, and mucus accumulation is a sign that the vibratory wave is dampened in this location, so it is suggestive. Then we hear the diplophonia from the vocal cord breaking up into 2 different segments. Singers abhor a bad sound and often stop phonating at the first sign of a change in quality when, during a diagnostic exam, that is exactly what we want to happen and to see.
So these might look kind of normal at first, but if you look closely, first of all, there's a node or a nodule in the middle, so it keeps them from closing completely. And check out those capillaries. That is not supposed to look like that. They're supposed to be up and down straight. And you can even see the nodule or node there. And see how jagged that edge is? Those are not healthy vocal cords. Let's listen. This has been an attempt to torture you and give you nightmares. I hope you enjoyed it.